According to the Uganda AIDS Commission, status of the national HIV and AIDS response in Uganda as of December 2022, statistics show that a total of 1,400,000 people are living with the disease. Uganda recorded a decline in the new HIV infections from 54,000 to 52,000 in the period of 2021 to 2022, which translates into a decline of about 4% according to the country estimates and projections of May 2023. Oftentimes, we see that the pressure of testing for HIV is put on the female population right from the mandatory tests done at antenatal screening during pregnancy, with men getting little or no attention on the issue. The Minister for Health, Dr. Ruth Acen, has advocated for the need to have more men test for HIV with the newly launched accurate, efficient and private-oriented Wondfo HIV self-test kit in the self-test campaign in Uganda.
Your health is in your hands, and a good example begins with you. Therefore, continue to work very closely with our AIDS control program and the Uganda National Health Laboratory Services so that this program is a success. And I want to call upon the men to respond. Remember, we are running a race, 95, 95, 95. And we are behind with 195, and here it is. So tell the men, the women, please tell the men to do the needful.
The minister also said that the HIV self-test strategy will help cover a wide outreach and efficiently fight the spread of HIV.
Through self-testing in their convenient environments, we will be able to diagnose patients early for timely antiretroviral therapy initiation. This is vital for improving treatment outcomes and prevention of HIV transmission.
Dr. Cedric Akwesije from Microhem Scientifics and Medical Supplies explained the advantage of the self-testing strategy.
Men are not testing enough because when they are too busy, maybe they are shy to go to hospitals, and that's why self-testing may help to increase the numbers of men testing, confidentiality, to break stigma. So once you reduce stigma, many people are going to actually come out and test. They will now become more cautious once they discover that they actually are still safe. And if they discover they have any issue, then they will run to the hospitals for help than keeping in the dark.
Akwesije noted that the test kit budget composed of internal and donor funds are $3 million spent annually to import these products. He recounted the advantage that will come with the launch of the self-test kit manufacturing plant on 24th November 2023 in the country.
This factory has capacity of producing over 50 million test kits a year for rapids and 80 million test kits for PCR. The country is going to retain this money. Instead of exporting money to buy kits, they will be buying their own kits. Number two, many other countries are going to buy also from here, so foreign earnings, jobs, everything, access, availability, reliability, all those ones will be here.
HIV, human immunodeficiency virus, is a virus that attacks cells that help the body fight infections, making a person more vulnerable to other infections and diseases. It is spread by contact with certain bodily fluids of a person with HIV, most commonly during unprotected sex or through sharing injection drug equipments. If not treated early, HIV can develop into AIDS. Mary PRIMA Award, for Uganda Family TV, News at 8.